Okay. So very good evening, ladies and gentlemen. I'm Rakhi Bakshi on Her World India Talk Show series, and we bring to you on Her World India a show every Saturday where we talk about gender issues, social issues, and also contemporary and current affairs. But this time, during the time of crisis, we are bringing you this show every day because we think that bringing voices to you every day has become very, very important and crucial. We, along with Policy Center and Gender Lab, Miranda House, Delhi University, are trying our best to bring you all the insights, information, communication from stakeholders, from voices that matter from all around. And this time, today, we thought, why don't we look at Northeast as to how Northeast is prepared to tackle this critical time crisis of the second wave of COVID, which has really struck us very, very badly. And seriously, at this time that we are talking, it's a very, very significant time, a crucial time for all of us Indians. So many lives are being lost. So many people are battling right now in hospital as we talk. So many people need urgent medical attention. The authorities are at work. They're trying to do their best in terms of planning, managing things. But we would really like to bring to you all these thoughts from the Northeast. So the policy planners, we have two very, very special and esteemed guests with us today in the show. And I'm thankful that they have taken out time to join us on Her World India Talk Show series. So I start with the first speaker, Sir Mr. Jishnu Barua. He's the Chief Secretary of Assam. Somebody who's also worked in Delhi earlier in various senior capacity, but right now he joins us and we will talk about the preparedness as far as COVID is concerned in the region of Assam. Also, of course, about Northeast. The second guest we have is Mr. Sampath Kumar. He's the Principal Secretary, Health and Family Welfare, Government of Meghalaya, but somebody who's also looked very significantly earlier, not only at rural livelihood, women empowerment, but public service delivery. And he's also part of Lancet Commission on COVID-19 India desk. I welcome both of you, sir. And without wasting any time, I first go to Mr. Barua and ask him, at this time when the state actually just battled a very severe earthquake, how Assam is now preparing to tackle the second wave of COVID, which we are really finding out as to how critical this strain of coronavirus is. So, Mr. Barua, I would like to know from you the status as of today.
We have been battling COVID-19 second wave very earnestly since the beginning of this month. The number of cases on April the 1st was as low as 54. And today we have gone up to around 3,197, which is the figure which of positive cases registered yesterday. On an average, in the last 1 week or so, we have been getting around 2,800 positive cases. We are aware of the difficulties, the infrastructure difficulties that we might have to encounter in the days ahead in our battle against this dreaded virus. Firstly, we need to have adequate number of ICU beds in position and create facilities and infrastructure to meet the requirement of patients, and the number may keep on increasing. As of now, the number of patients requiring urgent ICU attention or ICU bed with oxygen support system is not very high. It's about, we have earmarked some 549 beds in government hospitals, and out of that only 225 beds have been occupied. But considering the fact, if you see that increase in the number of affected patients or persons, I think in next 15 days, the number may actually go up to a much higher level. As on date, we have around 23,000 odd active cases, which might go up to around 30,000 in another fortnight's time. If that happens, the number of patients who require urgent medical attention in hospitals might be in the region of 3,000 or so. Now, all these, in the entire 3,000 number of patients would not be requiring oxygen. But let me say about 1,000 may be requiring oxygen patients. Now, we have made special provisions for improving our oxygen supply. I'm very happy to say that all our medical colleges now have oxygen generation plants. They have been put in place, and not only those 7 main medical colleges, but also Mohandra Mohan Chaudhary Medical College, which is newly set up institute. Even that has a a oxygen generation plant. Over and above that, we have 6 other hospitals, primarily district level hospitals, where infrastructure is ready. And the moment the machinery is made available to us, we'll have the oxygen generation plants there as well.
Okay. Okay.
Our requirement, just to complete this, our requirement is, as of date, is around 25 metric tons of oxygen. Whereas we do have a little more, quite a bit more than that to meet our immediate requirement. But we cannot say about the future. For future, you require much more oxygen. And for that, we are also trying to ramp up our facilities, scale up our various infrastructure. So that is one. The other thing, apart from oxygen, is the beds. A lot of private, fresh facilities have been created. The main stadium in Guwahati, the indoor stadium in Guwahati, has been converted into a COVID center. One private university has been converted into a COVID center. So there'll be approximately another 3,000 beds in Guwahati itself to look after, to take care of the onrush of patients. But also later on, subsequently in the district centers also, we will be having these centers, the various.
So that's quite some information, but we'll keep coming back to you. I now go to Mr. Sampath Kumar. Thank you for joining us, sir. But I must begin by saying that, when this second wave struck us, do you think somewhere, and we have to really very realistically accept also that somewhere we were caught a little off guard? To you, Mr. Sampath Kumar, sir.
Thank you. Thank you. Just to respond to your question, the second wave is, compared to the first wave, what we had observed is that it has, its growth rate is very, very high. It's almost like in our state, it's a 6 times higher than the first wave. So it, during the first wave, to reach a level of 1,000 in first 1,000 cases, we have taken more than 4 months. In fact, Meghalaya was one of the states with lowest number of cases. And in the second wave, during this month, last month, in the month of April, we have actually, our growth rate has been very, very high, almost like 6 times higher than the first wave. That's one. And one thing that we have understood is that it's a very infectious, and it is also actually affecting both old and young people alike. In fact, what we observed is that in the first wave, the mean age of the deaths that actually in the first wave was about 59.5 years. Whereas in the second wave, it is now coming to 52 years. That means it is actually affecting even the productive younger population. So that's one. And number two is that the need for the oxygen related capacity also has increased in the second wave. So that's the second thing. So what we have actually been doing is that how actually we are actually looking at the data, how actually this entire growth is happening. And the only way, in fact, there are many ways, but for immediate slowdown of this virus is containment. So we are actually using containment as a strategy to slow down the virus, because our reproduction rate of this virus is very high. In fact, it is currently, as per public health experts, about over 1.5. That means each person who is infected is actually infecting more than 1.5 persons. So it's actually multiplying. So that's one thing that we have been actually telling everyone, okay, this is actually spreading. So how to contain? Only way to contain is that the intermingling of people has to be brought down. So that's something that we are doing that a graded approach. So in fact, from today onwards, we have a 10-day kind of intense containment measures, especially in the urban areas, because we have over 80% is a rural area. So in fact, the problem is currently in the urban areas. It can spread to the rural areas, and so rural areas have a very limited infrastructure. So our strategy is essentially to contain the virus and and isolate the virus and kill the virus. So that's the idea. That's the main approach that what we are having. For that, as part of the containment strategy, we also have been actually very aggressively, promoting the testing for anyone actually who is entering to the state, or any high risk contacts. Actually, we are testing them with RT-PCR, and also we are also quarantining them for about 7 days. That actually essentially to to reduce the spread. And at the same time, we are also using mask wearing as actually is one of the a containment strategy. In fact, every person can contain the virus by wearing a mask. So that's something that we are promoting: a medical mask wearing, double mask wearing. So these are some things that we are actually promoting these 10 days. And in addition to that, as I said, like vaccination is something that is as a strategy. We wanted to build the herd immunity in the next 4 to 5 months, so that we would like to vaccinate about 70% of our population. So that's something that second, important category that we are working with.
So,
Yeah.
so as far as Northeast is concerned, what is the vaccination plan, sir? If I may ask you the current status.
Yeah. See, the vaccination, in fact, this is again, it started slow, because one of the reasons is that, it's again, it's a general, in especially when you are, something is new coming, especially in a setting like us, like with a large number of indigenous population. We do really, it takes some time to really, to remove all the fears, or, all the misconceptions. Yeah, it took some time, but like it has picked up very well. Now, actually, we are, daily vaccinating over 10 to 15,000 people. And if we can actually, if you vaccinate over 20 to 25,000 every day, we'll be able to achieve by August 15th, we should able to vaccinate everyone with one single dose. So that's why we have a plan for vaccination. In addition to that, like I'll just finish this one. There are three things. One is containment, second is vaccination, and the third is the treatment. In fact, treatment is something is very important for the second wave, because the second wave, a lot of people are getting affected. So we need to really equip them how actually we can diagnose them early, and provide a basic treatment that would actually reduce the seriousness of the disease, and also to reduce the kind of a stress on the limited infrastructure that what we have. So this is the kind of for that actually we have come out with a strategy that like a mobile medical teams who would actually provide home-based COVID care management. So that also we have just introduced, and that is another thing that we have been working with. Thank you.
Sir, I'll come to Sir Mr. Barua, to you, but of course I'll keep going to both of you. At this time, sitting in Delhi, one is watching this whole sense of despair, desolation. We know so many people are right now struggling for beds, oxygen support. On social media, every day, the timeline is full of crying for help from so many people. Strangers are trying to help each other. I'm sure that there are meetings happening at this time that I'm talking to you. There are at the government level also meetings are happening. But looking at Northeast, and the concerns were that sometimes we feel that what kind of infrastructure is available there? Is it that in the talk for looking at Maharashtra first and then Delhi, are we not looking adequately at Northeast? And that's where we also thought of looking at these two states, especially Assam and Meghalaya, where we thought we should get an idea as to what's happening. In Assam, as I mentioned before also, first the earthquake, now the rainy season, all these other aspects will also double up. And at this stage, to prepare for such an emergency like COVID and its second wave, about which the experts are saying that this variant is something that we are still trying to understand, because it's manifesting itself in so many variety of ways. I mean, the doctors are saying that you don't know which one exactly will surface. It's not only fever, but so many symptoms are also being discussed at this stage, sir. In Assam, what all is being done in terms of how the government has created plan which is citizen-centric, trying to create a dialogue, communication, a kind of COVID helpline center, a very nodal system which is at work right now. So, Mr. Barua.
Actually, when you come to the way Assam has tackled COVID-19, the first wave, we were very successful in flattening the curve. This wave has come to Assam sometime in the second week of April. and it struck us very badly from then onwards. But what we are trying to do is firstly ramp up the number of testings. By scaling up the testings, we have been now doing about 1 lakh, but we will do even much more than that. Testing is absolutely important. And in fact, if I may share with you, we have never really lowered our guard when it came to testing. Assam was the most difficult state for people to walk out of the airport when it came to restrictions. Even in January and February, we were still insisting on the certificates, the negative certificates, COVID negative certificates. And thereafter, now at the airports, we are whether or not the person comes with a certificate, it is not important, but every passenger has to go through both the RT-PCR, the RAT test, antigen test, as well as the RT-PCR test. And there is a requirement of 7-day quarantine for passengers before they can move around. So this is what we have been insisting upon. Testings will increase more, and then even at the railway stations and also at the interstate bus stations, especially on the border, testing has started in a big way. We hope to increase the testing to around 1.5 lakhs at some point. And then thereafter, tracking. Now, tracking has been very successfully carried out because of our experience in tackling other epidemics in the past. So we have the experience of doing, and there is community surveillance going on. And we've been taking things to the logical conclusion when it comes to positive cases and the persons that affected person may have come into contact with. So there is a plan in place. We had an election recently, and in a few days' time, a new government will take over, and entire focus will be on how to tackle this pandemic. We have to increase the testing, number one, be extremely alert at the airports, and also alert in ensuring there is proper tracking. And lastly, but certainly not the least, is improving the quality of treatment and expanding the treatment in various places. Because now, unlike the first wave, the virus has spread to the rural areas, and it's far more difficult. And as Sampath has mentioned, it is definitely more infectious than the first wave, especially with the mutants coming in. The new variants are extremely infectious. So we have a plan in place. As I had mentioned earlier in my opening remarks, there's an expansion of capacity. Oxygen is in place, but we need to do much more. And that's why we have had a meeting with various stakeholders and agencies like the army, the oil companies that are doing business in Assam, the IOC, the Oil India, ONGC, and also Airport Authority. And all these agencies have also assured us help. Will be also Air Force, if I didn't mention that. So we are trying to pool our resources to ensure that there is a coordinated action. Army is going to help us in vaccination, and so would the railways. So that's how we are, planning.
So medical resource, health resource is something which has become very critical. I come to you, Sir, Mr. Sampath Kumar, and ask you, at this stage, we are also really talking about the health infrastructure. Hospitals, in some cases, are crying for help themselves. So the hospital management today, as I talk to you, just read that Batra Hospital actually lost lives, including doctors. So hospitals are crying for support in terms of availability of urgent medicines, oxygen, beds, and all other critical support. So how do we really look at, especially when you talk about your region, this whole health infrastructure being in place, or the measures right now being taken, sir?
Yeah, no, it's a very good question. In this entire COVID management, one of the things that very important is strengthening these health systems, because we have a limited health systems. We have a limited beds, limited infrastructure, and whereas we have a large number of cases are coming. So it's a challenge. We have in terms of supply and demand, there is a huge gap. So that's one. So one thing is that, like, all the states have worked over a period of time, especially during the COVID wave one, is to improve that infrastructure. Of course, COVID wave two is actually requires even more infrastructure. That's something that we have, created a kind of a high-powered committee, and trying to expand as much as possible. So yes, in that process, definitely, we are actually stretching the capacity of the healthcare, the providers. It's a tremendous challenge for them. But one good thing is that majority of the healthcare workers have been vaccinated today. So that's something that first, as a strategy, the government has done was that vaccinating all the healthcare workers. That's one is that they are actually, one is that they are better equipped in terms of their protection. One is that, and we have unlike COVID 10, we have the basic equipments. We have like N95 masks. We have like the ventilators. We have some oxygen. Every some. But like again, as I said, there is a limitation. So the kind of the way the wave is coming up exponentially, what we have to do is we have to really contain the spread. Otherwise, this entire healthcare infrastructure would be overwhelmed. So we need to actually look at the data on a daily basis and see how actually the growth is happening. And we should take a containment as a strategy, as a macro containment, as a strategy to slow down the virus. That's the only way actually we can handle the situation. Otherwise, as you said, healthcare infrastructure and healthcare people are being overwhelmed with the kind of a pressure that actually is being coming up, because this is not for which actually we have not prepared for. In fact, it's a kind of a pandemic, and it's completely unknown thing. So normal technical solutions might not work. The standard technical solutions. We need to really think out of box. As I said, like for example, we are thinking how can we actually provide COVID, in fact, the care even at home. So some of these things I think we need to really think. And the very important thing I would like to mention here is that it is in fact it is actually we need to understand that this problem is felt by everybody, and everyone is part of the problem. So unless everyone actually takes full responsibility in solving the problem, only healthcare workers cannot solve the problem. So in fact, it is a community.
It's actually coming to that, sir. Talking about community chain in your region, how communities could help each other, because we know that especially in Meghalaya, when you talk about it, there is a focus on that also. Would you like to elaborate and talk about that as to how these chains, small networks of communities can be maintained because of the kind of nature of society also that it is in Meghalaya?
See, as I said, like, this is a very adaptive challenge. It's not like, it's, as I said, like this is a problem is not known to many. It's a very new thing. It's a very infectious. It's causing a lot of fear. So when we have this one, we need to really, build the capacity of the people, So what we have put a lot of emphasis right from the beginning was that like how to actually build that community capacity. And so we have actually followed a kind of a decentralized and distributed leadership model. So where we are actually at every locality level we have a community COVID management committees, so which are headed by the traditional headmen, which are and supported by the frontline workers and the magistrates of that particular area. So these community COVID management committees, we have over 7,000 of them across the state, representing every village and every locality of the urban areas. So they have been actually providing a great support because they are sharing the responsibility. They understand the problem. Okay, what is the containment? What measures we should take in that locality? So they are coming up with local solutions for the local problems. So that way, we are able to that's a very important thing. What we found is that because this is also important, especially for the COVID, one should not think that like this virus is coming from outside. Maybe we might be causing the spread to others. So that sense of responsibility, especially we call it like in the behavioral science, it's called changing the locus of control. Instead of looking from for the solution from outside, looking for the solution from internal. So changing from external to internal. So once we start bringing that perspective, so each one will become like a healthcare worker. Each one can actually will try to solve the problem more effective, because the way that we are seeing across the other, for one of the things Northeast has the advantage is that it is coming now. in fact, we have an advantage of learning from what is happening in other places. So we can actually take some corrective measures. Like we have a lead time to, prepare the communities. In fact, the same thing happened in the COVID 1.0, and same thing is happening COVID 2.0. So though we are, slightly, remote, and, we have problems of limited infrastructure, but one advantage is that we also have this, got early information, how actually you can prepare yourself and secure your state. Thank you.
And as far as oxygen is concerned, sir, you'd like to tell us, maybe you're seeking help from plants. In fact, what I know and my knowledge says that there are two of such nature.
Yeah, in fact, we are coming with the different kinds of things. One is that we are even actually trying to get a liquid, especially cryogenic plant. Two plants actually, one in Khasi Hills, another in Garo Hills. That's one which would really help in terms of refilling this entire oxygen cylinders, because we depend a lot on. We also have within the state, we have a oxygen generation plant is there. We are also we have in fact also tied up. In fact, our chief minister went personally to get that thing done. So that way we are getting in fact, we also wanted to ramp up this cylinder. We have actually identified about 6 hospitals where actually the oxygen generation plants are coming up. So in fact, our idea was that this entire containment measures, we have another 10 days, almost intense containment measures, almost like a semi-lockdown in urban areas. So during this period, while we are actually containing the, and stopping the intermingling of the people, we are also actually planning to ramp up this infrastructure. So that is the idea that with which we are working.
Sure, so I will keep coming back to you with more information that you can share, because it is also about people and citizens. And see, in your earlier experience, you've of course looked very diligently at public service delivery systems. And in fact, in your experience, as I was just trying to understand, you've done a lot of work at the ground level as far as implementation programs and executing them is concerned. I'll keep coming back to you, sir, on that. To Mr. Barua, there are challenges, of course, one understands at your level. One is to tackle this deadly coronavirus and its second wave. And second is to look at economy as to how one can also try a parallel way, look at, looking at it, I mean, to contain it, to solidify it, because at this stage we see that people get into panic. We have migrant laborers, flocking from here to there to going their own places. How you're really looking at this double challenge, so to say, looking at how to give more faith to people, create more trust through measures, talking about them, creating awareness campaigns, and telling them that, one is at work. But also looking at, strengthening the economy, which would also gradually will become a bigger challenge.
Ms. Bakshi, what we have been doing in Assam is not coming down like a ton of bricks when it comes to restrictions. We have been following a gradual phase-by-phase approach. Whatever restriction we have been placing on economic activities or any other social activities is evidence-based, which is why there is no lockdown except night curfew from 8 o'clock to 5 o'clock in the morning. And everything has been thought through to share with you why we are having the night curfew only up till 5 o'clock and not 6. Because 5 o'clock is the time when the vegetable vendors and milk vendors enter the city. So we don't want any extraordinary hike in prices or a soaring of rates. So therefore, we are deeply concerned about that. At the same time, we also want the economy to continue functioning, and which is why restaurant business have been allowed, for instance, to have home delivery even after the closure of the shops, to dining in, host people, customers. So till they can have takeaways till around 8 o'clock, and after 8 o'clock, even after that, they take home, home deliveries permitted. There is no bar on e-commerce. We have been thinking through all the restrictions so that we are also not initially, we did not even put all these restrictions all over the state in places and districts where the coronavirus had not impacted so much or so adversely affected. We did not impose any restrictions. But by and by, we feel now that it has to be uniform. But yet, we are not overdoing it. We will go step by step and a gradual fashion. That's how the economy is also has to be said. And this is the experience from the first wave, that we need to also allow certain activities to go on, and yet it should not adversely affect the public health of the people.
One of the things, sir, that we've observed and we are observing now is that, earlier somebody said that, it's about age, that if somebody is elderly, somebody has comorbidity, then there are more threat. But right now we're seeing, in fact, we just lost few journalists, not only Rohit, but there are some other journalists we just got the news we lost. So some of these are very young people. There are new phenomena happening. How is one really creating, the right kind of, as I also said, awareness campaign, information? I was just watching that your dashboard, and you have actually quite comprehensively tried to tell people in a very step-by-step manner as to what facilities are available. Would you like to talk more about that, as to how the disease now is in its new form, and how different kind of measures, looking at different kind of sections? For example, there are women, there are girls, there are children, and specifically looking at sections, screening it properly, dividing it properly, and then targeting it accordingly.
Yes. The positivity rate in Assam is still less than 5%. Yesterday it was 4.43. When the positivity rate goes beyond 5%, then it's a matter of very serious concern. Alarm bells will start ringing. But there are various sections of population who need to be treated not in a uniform manner, but in a different manner. For students, for instance, we allowed the schools and colleges to function for a while, but now the time has come when we find that the number of affected COVID-affected persons in that particular district where the university or college is located has crossed a particular mark. When that happens, we felt that there needs to be a closure of all these institutions. But initially, in some places, the schools were functioning, colleges were functioning, and people went about having their normal classes. But now, time has come that we need to be a little stricter in allowing students, allowing these institutions to run, which is why we have now gone towards the digital platform, which is to say online classes are being carried out. So physical classes have stopped as of now. So that's as far as students are concerned. But for college in offices, we have only insisting on 50% attendance. And in the secretariat, for instance, we do not allow anybody to enter, because that might again impact upon those people who are doing urgent work in the office and very important, rendering important services. People only with COVID negative certificate and only on very, very urgent work are allowed within the premises of the secretariat. But however, we are accessible all the time on telephone and on email. We do get number of telephone calls. The government is functioning. Everything is functioning. The deputy commissioner's office is entirely open, and these are the field level officers who are open. So 50% attendance is how we are going about it. We have also stopped, we have exempted women with children less than 5 years, who have children who are less than 5 years from attending office. We have also exempted persons with disability from attending office. So all these things are taken into account while we talk about implementing these restrictions. So different strata of society, different sections of community would require a different sort of treatment and or set of policies. And that's how we are going about. I'm as you're aware, the health department is quite effective here and in Assam, and they have launched a huge campaign to alert the people, to spread awareness, and it's been quite effective to the best of my knowledge. And over and above that, we have been, since yesterday particularly, the Guwahati police has launched a massive drive to ensure people wear masks.
Sure. Because our experience says we also look very critically at gender issues and what's happening about women and girls, is that we've seen that in such cases when there is a crisis, women also face multiple challenges, whether at home there are conflicts, to how to get medicines at the right time, to how to get social security also. So I think all these angles have to be kept in mind. That's what we think. I'm sure that socially also, sir, there are measures in place.
Yes, that is true. But sadly enough, women and children get very adversely affected during a pandemic such as this. We know, for instance, the Anganwadi centers had to close down, and only home delivery is now permitted. So that is going to impact upon the nutrition status of small children below 6 years of age. To a certain extent, though home delivery is insisted upon, but the Anganwadi, wherever they were functioning very well, children were getting enough food supplement and nutrition supplement. Now that is going to be, they're going to be deprived of that in the current scenario. So small children are going to be affected. And during this period also, the women, as you very rightly mentioned, do get affected in various ways. So the Social Welfare Department and the Women's Commission have also been extremely active in trying to come out with some SOP. We are coming out with a SOP, for instance, on child labor very shortly, because we also want to ensure that during this period of deep distress, there should not be multiple cases of, child labor or child victimization that sometimes occur in society. So
on the social aspect, I would now really like to go to Mr. Sampath Kumar, somebody who's really looked at the social audit. Sir, to you, Mr. Sampath Kumar, how would you really look at, looking specifically at the needs of what we call sections which sometimes need more focused attention? And I am talking about women and girls and children. Women and girls also, especially because in a crisis like these, whether it's a natural calamity or any crisis or disaster, especially this pandemic, women face multiple problems, as I was just talking to Mr. Barwa about, whether at home, domestic violence, abuse, whether conflicts of all kinds, whether how to get access to healthcare, to solve transportation problems, to communication, all these problems really, really rise. So how are you looking at it and dealing with it also?
Yeah, this is, you're right. In fact, as Barwa sir has mentioned, there is this, especially the women, and children, they face a lot. In fact, they suffer a lot during a pandemic situation. And I would just like to add one more thing. In fact, there is a greater burden on women in general, not only, during the pandemic situation, even during the normal, situation. So one thing that what we have been doing in Meghalaya was that right from the COVID, wave one, like right from last year, we have had a separate focus on mother and child health issues. In fact, especially we have a separate focus, means like every alternate day when we have these video conferences with the deputy commissioners and the health teams, we also have like once in a week, we have a review of this maternal and child health related issues. But we started actually measuring, how actually, from every district wise, health center wise, how many mothers have died, how many children have died. So we started actually looking at that maternal mortality and, infant mortality very closely. And we started actually understanding what are the reasons. And in fact, over, with that weekly, reviews, we could understand the problem, very, significant problem. One, we have this, as you said, clinical management problems, like, where when you go there, you don't have a specialist like a gynecologist, an anesthesiologist to do a cesarean operation, because in the remote places we don't have a specialist. But that's one problem. The other problem, we don't have a skilled birth attendants in some places. So the second problem, what we find, a lot of public health related problems. And the third one, very important thing, what you mentioned, is related to the socio, gender related problems. That's a very important thing that what we have observed. And in fact, that's where we started working very, when we launched a rescue mission. Rescue mission is essentially saving lives of mothers and children. So based on like the analysis of the data that what we got for the last 1 year, we could able to come out with a 11-point strategy, how actually we can reduce the deaths, because how. So that support system, again, we have created, working on all the three areas, like strengthening this clinical management issues, public health dimension issues, and the socio gender issues. So there we have been involving the women self-help groups very actively, and we have created a cadre for the self-help groups, which we are calling community health and gender activist, like ASHA. You have a community health and gender activists, a new a cadre we built in the state, where actually they are mobilizing on from the gender and health aspects, are both are very interlinked. For example, many mothers are dying because there was no birth spacing. So lack of, it's again a reproductive right, how actually we, because if you don't have the spacing, if you don't give a minimum of 1,000 days spacing, if a mother cannot actually, cannot give another delivery safely. So some of these things actually we are trying to bring the science to the people. It's not like many times, the science.
I could see.
So that's where we have been working now in terms of building that the capacity of the state to rescue the mothers and children. So yeah.
Okay, one question which I'll of course ask Mr. Baru also, but first to you, is that there is a question coming in, because there are viewers who were also writing to me, is to what is the role of police force? I mean, how do we really, maybe we sometimes feel that we need more specialized training that police should undergo in terms of tackling people at this stage, or these kind of situations. We either see some very extreme, they have also been very helpful. So there are all kinds of things which have happened vis-a-vis the police or security force. But in Northeast per se, and in your region, how would you really look at the police handling such things?
Look, police in Assam particularly, I mean, played a very important part in the first wave. They took part, they were also were part of the medical team in whenever they went for trap, and when the teams went for tracking. And then also in these testing centers, they were there to ensure the compliance of masking. Police has always played an important part. And that's why now, as I was telling you, the last 1 week or so, we have started becoming extremely strict when it comes to the insistence on wearing masks. For instance, in a small place like Haflong, which I had been to a few days ago, police started, on a major drive to ensure that people start wearing masks. And about maybe, I think around, I was told about 10 lakhs of fine was also collected, and people happily gave away that penalty amount without any hesitation. But they all realized that it is important and necessary for them to wear masks. Now, for us, the most important thing is to wear masks to stop this chain of transmission. That is the first important thing. I mean, otherwise, there is no other protection against this virus, the spread of this virus. The police also is now being trained in various ways. Now, they are also a part of our various committees. The DG himself has been playing a very important part, and also the ADG, the Special DG Law and Order. Both of them are they've been sensitized to it, and they are all sensitizing their men in various platforms to ensure that COVID appropriate behavior is maintained by the police themselves, and also ensure such COVID appropriate behavior is maintained, especially in the last, I can say for sure, the last 10-15 days, they have been extremely active You're aware that we had elections and all that, but now that's all that is over. We are totally focused on trying to at least minimize the spread of this disease or virus. So you're quite right. The police will have to play a very, very important part. These are the boots on the ground. They'll have to come in support of our medical staff whenever there is resistance. In many places, we find that people were refusing to get tested in the first wave. But this wave, the people are quite compliant. They've been coming forward, and in the first wave, it was the police who had assisted the medical staff in ensuring that all anyone who's not coming out for the test or not willingly coming forward, then they were forced to go through the tests.
In fact, in Delhi, we have seen some of these police officers helping out, reaching out to normal people. In fact, one of the cases yesterday where police, in fact, performed the last rites of a journalist who was living alone. So many of these new facets of reaching out to common people have also shown police in their most human manner, and we must place it here also. To you, Mr.
One more thing, I forgot to mention this, and I have to say this. In the first wave, police were also distributing food, like we have seen in Delhi. This has not reached the national media, but we in the state, it was shown in all the local channels, how the police themselves were also distributing food. And in many places, when there was, in the first wave, when there was complete fear, anxiety, and insecurity, it was the police who had come forward and, made food available to the migrants, to people who are disadvantaged, who are unable to go out of their houses. In any case, there was a total lockdown. And at that time, police had come to the rescue. And this is one thing that I have to share with you. And kudos to our police for doing that.
Sure. In fact, we are bringing out all these different human aspects also, which we get to know about. And it is only our duty to also place it for everyone to see and understand. To you, Mr. Sampath Kumar, now, one of the things that when we are talking about awareness campaign and the right kind of information going out, we are also seeing hoarding happening at this stage. We are seeing black marketing because people of all kinds are there around. And, as far as this remdesivir injections are concerned, there's so much talk about it that we see that sometimes people have hoarded it. There are all kinds of rumors related to it about availability, non-availability. What would you like to say? How would you like to clarify and put the right position there?
Yeah, there is this problem. Of course, it has not yet come to our state per se, but like we have been hearing, so we have taken some of those steps. Essentially, we have a system to, monitor this entire drugs, within the state. What is the stocks that we have? How many patients are we have? So we have a system like to really look at the entire drug system. But as you said, like these medicines, in fact, remdesivir and all, there is a lot of shortages there. Even like we also don't have many vials, but like we have taken a loan from the government of Assam. So that way, there is a shortage of this medicine. But again, if you go by the medical experts, what do they say is that remdesivir, the way actually we have been looking at it is not the only solution. In fact, yes, there are reports that like will reduce, the hospital stay, but there are many, steroids and especially blood thinners and all other medications which are very, very vital and very important. They're already there. They are in a very good number. So only the key thing in treatment is that how actually we are diagnosing the problem at an early stage and making sure that it doesn't progress from one stage to another. In fact, we have categorized all the patients into 4 categories: category A, category B, category C, category D. So category is essentially asymptomatic people, and category B is mild symptomatic people, and so the categories is moderate, who have some breathing difficulty, but they might require oxygen, and category D is actually those who require oxygen and even the ICU bed. So our strategy is essentially to see that the people, to identify the people at category A level or B level immediately, so that they will not actually be diagnosed at a very later stage where you cannot actually help them out. So it's a very in fact it's a very in fact the way the strain, in fact we have a medical expert committee with, where we keep actually getting this information on a very daily basis. The people, very young people are going, and they don't show much of a signs, but if you take their x-ray, already their lungs are affected. So, and in 2 days they require oxygen. So it's a very this disease actually is especially very one is like highly transmissible, but at the same time very unpredictable in the way it is affecting different kinds of people. In fact, it's a that way we have to very closely monitor. Only one thing what we need to make, we need to educate people to understand, and diagnose themselves. Unless we bring that science over fiction, we have a lot of, another one problem is that, like, we, most of our, we have a tendency to
So
experiment, like I call it, like.
my 2-3 last questions, but I think are important. One is that what we are understanding now is that the peak time is, somebody would say, till June. There is no respite. Two things which would really, I mean, it's very easy to ask people like you sitting at the helm of affairs that, you are planning, you are looking at policies, how to look at coordination. So coordination, for example, within the Northeast, within different states, or states in general here also in the country, and two, how to speed up the right kind of processes. I know it's very easy saying it, but I mean, if you could tell us that how, at the policy level, one is really trying to look at strengthening and making the chain solid altogether.
Yeah, basically, coordination happens with, the way you actually take the decisions faster. So the policy, is a very important, actually, policy making it should be very dynamic and agile. In our state, in fact, we have, I just want to tell you, morning we have a, meeting with the collectors or the deputy commissioners, and then afternoon we have a meeting with the chief minister, with a group of ministers. Evening we have a meeting with the health professionals and medical experts. So when we actually have this kind of a rigor, and the decisions are taken on a daily basis, that is required. Then it will be able to handle this. So what is required is, as you said, the right kind of a coordination comes with a kind of a, how quickly we are taking decisions, because this is a very dynamic situation. As I said, it's a very unknown thing. You need to take decision based on the data that is available. So that, if you ask me, one thing that what we require is, we require a very agile, adaptive system, especially for policy making and decision making and for implementation. Thank you.
Okay, Mr. Barwa, would you like to get
Can I add a little bit on the cooperation?
Please go ahead.
Actually, I did mention about the cooperation that we are trying to bring about among various agencies and stakeholders, including Army and Air Force and such, and CPSUs. But I have to say that the states in the northeastern region are cooperating among themselves a very good deal. In fact, I have the record with me. We have supplied remdesivir to Arunachal and Meghalaya, and oxygen to Manipur and Tripura. In return, Meghalaya has been very kind to support us, the kit for conducting RAT tests. So therefore, there is a healthy cooperation in place when it comes to combating COVID. So apart from the various agencies, we also have the states which are cooperating. We are all in it together. That's for sure.
Yeah, that's very heartening to know. In fact, one of the things that I was reading is that Nagaland also gets 3 oxygen plants that it was awaited, I think is on its way. So some happy news also coming in, but I think there are new learnings. If I have to ask both of you, what are these new learnings we have? Beginning from you, Mr. Sampath Kumar, the learnings which became very critical at this stage. We had never seen anything like this.
Yeah. So the new learnings, I would say, one is that, we need to really invest a lot in healthcare. Health is, if the health is so important.
System of placement of beds.
So definitely, our focus on strengthening the healthcare systems, both on the supply side and the demand side. Not only improving the infrastructure and on the supply side, public healthcare and the private healthcare, but we should also actually build a lot of strengthening, especially the capacity at the community level, because the reason is that this kind of pandemics cannot be handled by at one level, or as I said, like only a supply side. it requires everyone. There should be a distributed leadership, in terms of that capacity. So we require to invest a lot on, because there is a still, if you look at the problem in India, if you look at the overall, it's essentially, how much actually we are following the science is the key thing. If we are not following the science, we are following, some fiction, or if you are actually more, into the heuristics. I call it heuristics is essentially an experimentation we do a lot, but we should also, especially in the pandemics, when we don't have a very concrete, so we need to really trust, because the science has brought us to this level, the way we are as human beings. We really need to, a lot of faith in the science, and also faith in the, our own, the human capacity to overcome these challenges. So I think I would say that is the main thing that, the learning that what we have. So in fact, our Meghalaya state has brought a state health policy during this, COVID period, especially how actually we have defined our, entire, goals, how actually we wanted to strengthen that entire health system. So
Yes, and to you, Mr. Barua, at this stage, we know that many of the help is also coming from some other countries as well. They've also reached out to us. So much of support is coming every day that we hear of from other countries. At this stage, everybody has a viewpoint. I don't want to go deeper into those areas of foreign policy, but somebody would say that there are measures that, some of them maybe took. Even within Maharashtra, we saw that how certain things were worked upon, and we are seeing some changes there. So, what are again these steps that we need to learn, we need to practice, we need to act upon, that will at least make us a little more confident about dealing with things at this stage?
Yeah, that's a very important question. In fact, I am of the strong view now, and I think everybody's realized this as well, is that we cannot lower our guard. Even if this second phase, we are able to, second wave, we have been able, if we are able to combat it successfully, it doesn't mean that the third wave will not come. We have to be constantly on the guard, number one. And number two, increasingly, we have seen the number of fatalities has increased, and the percentage of people dying is much, much more than earlier. And therefore, the provision for oxygen is something that we should always look for and start planning. And maybe even if we are not so adversely affected as a state in this phase, I think we need to put in place adequate oxygen, in terms of storage and also generation plants, so that nobody should be gasping for oxygen at the critical hours. So therefore, we shouldn't lower our guard. Number two, we should have adequate infrastructure, including oxygen, generation plants in place, and storage facilities in place to meet with the next wave as and when it comes, and also tackle with the current wave, which is we have not yet peaked. Third thing is that cooperation.
We still are into that right now.
Right now it's not yet peaked. I mean, we'll be peaking maybe by early June, perhaps, and I do not know how badly we'll be affected. Could be worst case scenario. Could be even beyond our help. Beyond our immediate means to bring to provide succor to the people. But we are very alert. We are fully seized of the matter. And I think if we are now totally focused on this COVID, I think we will come up with a very strong response to this dreaded disease, at least in my state. I mean, I'm very confident about it. And people are working round the clock to ensure that infrastructure facilities are in place in our state. But cooperation is always required.
Add that I would say, and because so many people are writing and they're also writing their own opinions, and expert opinions are also coming in, is that how we should prioritize health matters urgently, also mix it with scientific temper. So the more science that we need to understand, in fact, all of our citizens are understanding at this stage right now that what we need to know much more about our own health, how to guard ourselves, because not everything we can just put across and say the authorities will do it or the system will just create a magic wand. It's people also who need to self-educate and work on their own health-related matters, their own lives, isn't it, Mr. Sampath Kumar?
Yes, yes, Rakiji. That's exactly the precise point that you said. We need to understand everyone has to take that shared responsibility at this juncture. Only through that we can actually handle this pandemic. So it should be, this calls for that kind of a collective responsibility and collective action. Thank you.
Yeah, so I think with you people, you have so much of insight, experience that one can keep on talking. But I think we'll have to leave it there because you also have important jobs to attend to. But I'll keep coming back to both of you, sir, for more information. And right now, whoever is watching, and I think more people should watch because this would be available also on the YouTube further, is that these are the measures being taken in Northeast. But I think more feedback, more learning from each other, more sharing of ideas would only help in tackling this pandemic and this deadly disease. But we will keep an eye on all that, and we'll keep at Her World India, we'll keep trying to raise those voices which really matter, as we are saying. So thank you so much once again to both you gentlemen, also looking at the problems that at large the society is facing, the women are facing, the children are facing. But yes, measures seem to be also being taken at this stage.
Thank you, Rakhi. Thanks.
Thank you so much, sir. To both Mr. Barua, you and Mr. Sampath Kumar. Thank you for sharing your valuable time and inputs. Thank you.